Good afternoon. My name is Brittany Baker. I am a Doctorate of Nursing practice student at East Carolina University, and today I will be discussing Health Information Exchange as a component of my Informatics for Advanced Practice Nursing course. Health Information Exchange involves the sharing of patient medical information between healthcare providers, and healthcare providers is inclusive of physicians, nurses, nurse practitioners, physician's assistants, pharmacists, etc., in hopes to improve that patient's overall care. And aspects of care that are ultimately improved would include the speed at which the patient receives medical treatment, the cost of the medical treatment that the patient would receive, and then even the overall quality of care that the patient receives. Another benefit to Health Information Exchange is also improving the access to patient information at the bedside, which ultimately influences medical decision making in hopes of reducing things such as hospital readmissions, patient medical errors, reordering tests that have already been completed, which also helps to drive down the cost of health care. Today I will talk about 3 types of healthcare information exchange, and those types of healthcare information would be directed in exchange, query-based exchange, and then patient-mediated exchange. So directed exchange would be a provider who maybe completes a referral to a specialist, and prior to sending the patient to that specialist, the provider would then send over whatever notes that they had that were applicable to that patient specialist visit. So that would be a directed exchange of healthcare information. Query-based exchange would be pretty much the opposite of that. Query-based exchanges are typically used for unplanned office visits. So I know as a provider in the retail healthcare setting, I would often complete query-based exchanges for patients because I see them on an acute basis, and maybe I need to just gather a little bit more information about their medical history prior to making medical decisions. And then we have patient-mediated exchange, and that involves the patient being in control of the exchange of their healthcare information. Next, I'd like to discuss some of the legislation that has been established and helps to encourage health information exchange. We'll begin by discussing federal legislation, and the first thing I'd like to discuss is the Health Information for Economic and Clinical Health Act, or HITECH, which was a component of the American Recovery and Reinvestment Act established in 2009. There are a few key components that I'd like to discuss in regards to the HITECH Act. One, it called for enhanced mandates in terms of abiding by HIPAA regulations, which is the Health Insurance Portability and Accountability Act. Another is that the HITECH Act required that patients have access or electronic access to their personal health information for those providers who had an electronic health record established. And the last point I'd like to discuss is the fact that the HITECH Act itself allotted for more than $25 billion to help improve health information technology. So from this $25 billion allotment, the Office of the National Coordinator for Health Information Technology was established, and this office helps to sustain the interoperability of healthcare information, and that is to act on the behalf of both providers and consumers. So there are a few key priorities set forth by this organization, and one of the priorities is that they aim to set clear goals for health information exchange, and then also they help to develop policies and standards that can solve interoperability issues both at the federal and state levels, but then also they encourage that patients remain at the center of health information exchange, and that patients again have access to their health information. The Centers for Medicare and Medicaid Services also helps to encourage healthcare information exchange through initiatives such as meaningful use. So through meaningful use, one of the requirements is that patients are encouraged to receive patient care visit summaries at the end of each medical encounter. So with those patient care visit summaries, patients are encouraged to then participate in patient-mediated healthcare information exchange. So next, I would like to discuss some of the funding that has been distributed as a component of encouraging health information exchange from a federal standpoint. So in 2010, Congress distributed more than $500 million through a health information exchange agreement program underneath the Federal Health Information Exchange Act. And as a component of that funding, each state was given a particular amount. For North Carolina was allotted $12,950,860, and the funding is used to both support innovative and sustainable health information exchange initiatives. And then again in 2011, an additional $16 million was awarded to 12 states through ONC's Grant Challenge program. So in 2011, North Carolina received an additional $1,708,699 to support health information exchange initiatives. In particular to North Carolina includes the North Carolina Health Information Exchange Act, and from that act, the North Carolina Health Information Exchange Authority was established in order to oversee and help to administer North Carolina's Health Information Exchange Network. So North Carolina's Health Information Exchange Network has been titled NC Health Connects, and this is an exchange that promotes access and exchange of patient health information within the state of North Carolina. So through the North Carolina Health Information Exchange Act, it mandates a few things in regards to the Health Information Exchange Network. One, it mandates that providers who receive state funding, so that would be reimbursement through Medicaid and insurance plans such as the Blue Cross Blue Shield State Health Plan, that those providers are enrolled in the NC Health Connects no later than June 1st of 2018, and then for certain providers there is an extension until June 1st, 2019 to enroll in the NC Health Connects. It was recently reported that 3 major healthcare systems had all signed agreements to join NC Health Connects in the near future, and this report was as of June of 2017, and those 3 healthcare networks were Duke Health, Novant Health, and Carolina's Medical Systems, and they would, or Carolina's Healthcare Systems, and they would be joining UNC Healthcare Network, which had already signed an agreement to participate in NC Health Connects. With those 3 major healthcare systems joining, in addition to other healthcare systems across the state last year, the NC Health Connects reported a growth of about 30%, which equated to 3.7 million unique patient enrollments in the system, which is fantastic. So now that I've discussed a little of the federal and state legislature involved in health information exchange, I'd like to discuss a few recommendations that were at the forefront of my mind as I reviewed this information. When I initially started this module on health information exchange, the first thing that came to my mind was I remember being in nursing school a few years ago, and I'm not really sure who the presenter was, but I recall having a presenter discuss in the near future that we would have patient information in uniquely coded USB drives. So as I was reviewing this information on health information exchange, patient USB drives came to my mind, and I thought that it would be an appropriate recommendation as an integration of the health information exchange network. So in one of the visions that I would have in terms of patient care is the ability for providers to upload information onto a medically specific USB drive, and that this USB drive would not be accessible by the patients or any layperson, but only by healthcare providers, and that it would contain encrypted files that could only be accessed by another healthcare provider, but it would provide a means for the patient's documents to be uploaded onto the USB drive for that patient to then take that USB drive to whatever healthcare appointments that they might have in the future, whether it be a specific appointment for a referral or, just if they needed to report for an acute or episodic visit, they would have their USB drive, and it would help to protect their information because it would be encrypted and no one would be able to access it outside a healthcare provider who was actually a participator in the North Carolina Health Connects or whatever health exchange or health information exchange network that provider was enrolled in. The other recommendation that came to mind was the ability to share information between health information exchanges, and I mean from state to state. So I know that would probably, as you know, more states are getting their infrastructure up and running to support health information exchange. I know that would be an initiative that would take some time, but it certainly would be a benefit to patient care. If you had a patient who needed to obtain emergency care on vacation or in another state, if they had just moved, it would certainly be a benefit for the patient's provider to be able to access information from the state from which that person had previously moved. So those would be my two recommendations on additions to health information exchange within the state of North Carolina. So thank you for listening to this presentation. I hope that it has helped to provide some additional information regarding healthcare information exchange. I know that I thoroughly enjoyed researching the topic and learning all about what North Carolina has in place, but then also the immense amount of support that the federal government has provided in such an important aspect of our patient care. So thank you and enjoy the rest of your day.